Hi class, my name is Ashley Spitzer and I am your adjunct professor for this course. This is my going on my 5th school year teaching at Lackawanna College. I am based out of Cleveland, Ohio, and I'm about 6 hours from your area, or Scranton, Pennsylvania. Um, and I really enjoy what I do. I've been a therapist for almost 20 years. And I really wanted to do another introductory video to give you guys an idea of who I am, what I've been doing, and talk a little bit about the first couple modules, and we'll go from there. So, like I said, my name's Ashley, and I've been a therapist for almost 20 years. It'll be 20 years next year. I started off in Washington, D.C., where I ended up getting a second bachelor's in social work, and I worked in a group private practice that specialized in mental health, but also social skills therapy groups for kids and teens and some young adults, many on the autism spectrum or with social anxiety. And I started off as an office manager and assistant therapist for 2 years, went back to school to get a second bachelor's in social work, which led me to have so many great opportunities and internships um, with research-based in criminal justice and mental health, substance abuse, and also my clinical internship at the Psychiatric Institute of Washington in their adult IOP dual diagnosis program, where I ran IOP groups, intensive outpatient groups for 3 hours, 3 times a week. I've worked at almost every level of care, and I also interned in the Cleveland area in the children and adolescent psychiatric unit, acute stabilization, so average length of stay was 5 to 7 days. Yes, it is hard and often challenging to work with children and teenagers. I was working with kids as young as 6 years old, and it can be overwhelming. It can be gut-wrenching. However, you can feel this way with adults as well, and we'll come back to that in a minute because I know we did talk about a lot of challenges that come with taking your emotions out of things. So we'll come back to that in a few minutes. And then, so from the psychiatric hospitals, I went to working with the court systems, intensive home-based treatments, to more IOP programs, to school-based work, and private practice. As of now, I've been in my own private practice for 5 years. I enjoy the flexibility, and I work with kids ages 7 and up through adults. I do specialize in dual diagnosis and the combination of multiple diagnoses. I do also specialize in trauma. I am trained in EMDR therapies. And if at any point you have any questions about my experience, please feel free to ask. You can ask in the discussion groups, or you can shoot me an email. And if you'd like to set up a time to talk over the phone or Zoom, we can do that as well. Somebody helped me out a long time ago and helped guide me through this process, and I'm a firm believer in passing the torch and helping guide you in any way possible that I can, both as a student, but as a practitioner as well. Now, as counselor, therapist, practitioner, clinician, I use those terms relatively interchangeably. For me, I go by therapist or clinical social worker. Technically, I don't have a degree in counseling, but we do the same things. All right, so I hope that gives you some perspective into my career and what I've been doing. This semester, I am teaching this course and cultural diversity and criminal justice. And then the second half of the semester, I am teaching behavioral processes and addictions, and I'm teaching 2 sections of that. And I want to let you know, if at any point that you have any concerns or are frustrated or need more from me, please do not hesitate to reach out. I am more than happy to help you. Now, the only time I will question you on this is if it is consistently at Sunday nights after 10 p.m. And it's not that I'm not awake, but if it's always that time, it means you've pushed everything off to the last minute. I get it. I often can procrastinate as well. However, it really helps to have a set schedule, whether it's different every week or the same, for you to get your work done. Regardless, please message me with questions. I don't want you to feel like you can't ask questions because you can. All right. So why counseling? Counseling and therapy, pretty much the same thing. It is as important as getting medical treatment because your mental health is important as your medical health because it can be chronic and sometimes it can unfortunately lead to death. And it's important to address that your needs and your feelings and your emotions are all valid. They're real. Your trauma is real. Your feelings are real. You're allowed to feel your feelings. And so people struggle with that. And there can be a huge stigma about getting help and feeling like you're crazy. We do see this a lot with boys and men because men are taught to be strong, and asking for help is seen as a weakness. When in fact, people like to challenge me on this, but my stance always stays the same. Asking for help is one of the best things and the biggest strengths you can do or have. You know what I mean? But why counseling? Because sometimes we need someone outside of our personal life to be a sounding board, to listen to us, to hear us, to validate our feelings. And it's private, it's confidential. And, they won't respond with typical cliches of think positive and, it will get better. You don't have it that bad. Because how does that make you feel? It doesn't make you want to open up to that person, does it? No, it doesn't. So someone who won't minimize your feelings. Counseling is a good time to vent and process things that have happened to you in your life that you don't understand and that you need to get it off your chest, because when we hold it in, it just stays there. Whether it gets suppressed and pushed down or not, it's going to come out eventually. That being said, moving forward into some of the things that we discussed this week, I have to say you guys did a great job on your assignments and your discussion posts. I'm really impressed with your candor and your honesty and your willingness to learn and to be self-aware. So I have to tell you, in graduate school, there is a huge focus on self-awareness and identifying your biases, your strengths, and your weaknesses. And they go over and over and over and over and over and over again. And it's so important to do this. And it might feel like you're, the old term, beating a dead horse, but it's so important to know who you are as a person and as a practitioner. And you'll find that your supervisors in your field practicum, your internship, will do the same because that's how they were taught. And I'm a clinical supervisor as well, and that's how I work with my supervisees as well. Because we are human. We all judge. We have our own morals, values, beliefs, ethical systems, our biases. And it's important to be honest and real about them and to know which populations we want to work with and ones we do not want to work with. It doesn't make you a bad person to say, I don't want to work with this population. Because if you don't want to work with a population, there's a reason why. For me, and something I have said since the beginning of my career, I do not go into nursing homes because I feel like they are too sad and too emotional. And as bluntly as I can put it, orphanages for old people, and they make me sad. And I can't be emotionally present and clinically present in a nursing home. So it's not a population I work with. And I don't do couples counseling because I have zero interest in it and never have. And if we want to dig deeper into that, it's because I grew up in a household where my parents constantly fought, and they still do because they've been married for almost 50 years and don't get along. And I don't want to be around that, and it's just not my specialty. But I do work with children. I have worked many years in substance abuse. Those are some fields that people specialties that people stay away from. To me, I gravitate towards it. It's something I very much enjoy. That being said, it's okay to say what you really want to do and what you really want your specialties to be. And over time, you'll start carving out some of your niche as well of what populations you work with, what demographics you work with. And it might ebb and flow, but there's definitely going to be, those core beliefs that you have and your biases that you have that will really define how you start off in the field, and that will track accordingly. Now, a lot of you presented the questions of how do you manage your feelings and emotions, and how do you put your emotions aside? Well, the truth is, we're human. You're allowed to have particular feelings and emotions because you're allowed to have them, and you're going to have them. And it's not even about, a lot of people use the phrase, oh, you're entitled to your own beliefs or blah, blah, blah. I mean, it's not even a matter of entitlement. You have them. You possess them. They just exist. So it's a matter of how do you manage them, and how do you learn to divide and conquer, and in a sense, appropriately compartmentalize and self-disclose. And I think that's something important that we will touch base on and continue to incorporate into the rest of the modules is self-disclosure and biases and self-awareness, because the way I was trained and what's really appropriate is the less self-disclosure, the better. If it is clinically appropriate and you can document and justify it, then you can share it. However, less is more. And it's because you want to have appropriate boundaries when working with clients or patients. That being said, it's important to note that, a therapist or counselor who shares too much can honestly project onto the patient or client. And that's not what we want. And we'll get to those types of, transference, countertransference, projection, all things that challenge that client, patient, clinician rapport. That is very important when building that therapeutic alliance. That being said, it's important to know yourself. It's important to know that your emotions are real and valid. However, there's a time and place for them. And it's important to use supervision, your supervisor, and taking breaks and taking mental health days when working in this field, because it is absolutely imperative that you are as healthy as you can be. You're going to have moments where you are really challenged emotionally. You're going to have moments where you're challenged ethically. Don't be afraid to speak up. Supervision means that you have a supervisor that you meet with one-on-one, and often in group supervision as well. And these are where you bring up anything and everything. Don't be afraid to bring up your concerns. It might make you feel vulnerable. It might make you question yourself or develop some imposter syndrome. However, the best thing you can do is be as real and genuine and authentic to yourself when in supervision. Again, if you have questions, I know I'm throwing a lot of information out at you, but if you have questions about this, please feel free to ask. Now, this week we're doing a case study, and we are focusing on psychoanalytic theory, which is fascinating and comes with a lot of questions. So feel free to ask questions in your discussion posts and replies. Feel free to tag me in them. If you have questions that you don't feel comfortable asking, you can email me with them. And if for some reason I don't get an email or I don't respond within 24 to 48 hours, please shoot me a message and remind me. I really do, care about you as students and as people and as, developing practitioners in this field. And I really want you to be heard and to be felt and to answer any questions or concerns that you have in a timely manner. All right, feel free to reach out, and I will see you in the discussion posts. Have a good evening.